Hello, this is Milka. I'm going to do hand washing. So on my tray, I have the antiseptic for cleaning my hands. I have the 2 towels. I have the brush for scrubbing. That's if I'm doing the surgical hand washing. Yeah, so I also have the hairnet. So I first wet my hands very well from the fingers up to the elbow. Then from there, I apply the soap very well and form a very good lather. Scrubbing from my palms. I start washing my palms five times each. Then I go at the back of the palm five times each. Then I interlock again. I wash that part also. Then from there, I wash my knuckle. From my knuckle, I wash my thumb. From my thumb, I will wash the tips of my finger. Then lastly, I'll wash the wrist. From there, if it was a surgical hand washing, I continue to scrub up to like the elbow. From there, I dry each side of the towel dries once. Then I change. I also dry the other side. Then I'll be done. Thank you.
Healthcare settings, we have two types of gloves. Our clean gloves, this is our clean gloves. We also have sterile gloves. Clean gloves are usually used when we're examining patients, maybe we're coming into contact with the patient's environment. And then our sterile gloves, we use it for sterile procedures like changing the wound dressing of a patient, maybe giving a vaginal examination, we use the sterile gloves. The first thing we do before wearing gloves is to wash our hands. Now that I'm done washing my hands, the clean gloves, this is how we put them on. And when we're done performing the procedure, we take care not to touch ourselves. This is how we remove the gloves. So this is how we take off our gloves. We start by holding here, then we carry everything to the next hand. Then from underneath, we pull out the glove and try to cover everything that's in that glove until we make a fold like this. Then after, we dispose of it in the red bin. We wash our hands first using the surgical hand washing technique. Next, we proceed to wearing the gloves. So we open it up. We try not to touch the inside because that's the sterile field, and we're trying to maintain sterility. So I begin with my dominant hand. I take care not to touch the inside of the glove. Next, I move on to the next hand by placing 2 fingers inside to lift up the glove as I introduce my second hand inside, taking care to put it on properly. So now I can be able to adjust the glove properly to make sure they're well fitted. Then I take up the position of someone who is sterile by lifting up my hands like this so that I'm able to maintain sterility.
Hello, I'm going to take you through West segregation, and in West segregation we have a red bin that has the highly infectious waste, such as loose soiled dressing, anything to do with the patient that has been soiled, we put in that red bin. We have the black bin that is used for general waste, the blood wrappings, the food remains of a patient, and in the brown bin we put pharmaceuticals, expired medicine that has not been used in the brown bin. Then we have a shops container, we put our needles, leads that have been used on our patients. We have this general waste, the wrappings, the papers, the used masks, we shall put them in the black bin. And here I have the soiled dressing from our patient. I'm going to put this in the red bin. And we have our needles here from the used cannulas, the used bin. We put in the shops container. We don't recap them after use, we just put in the shops container. Have medicines that have expired, have been not used in the hospital, so I'll put in the brown bin. Plus the vials and all that, put in the brown bin. Thank you. I'm putting on an apron. This apron prevents spillage because what I'm washing contains stains from blood and various things which I'm not sure of, so I'm staining my clothes. Then I also have to put on the shield. This shield is for protecting me from spillage when I'm washing the equipment, so I also put it for my own protection. Then I have a heavy duty glove. These are the ones I put on to secure my hands and also to enable me to wash the equipment. They prevent me from being pricked as I'm washing. The sharp object, the sharp duck, which contains the G water, will make it easy. Our G carbohydrate manufacturers concentration that is there, and here we have 3.5%. So this is the manufacturer's concentration. Then our desired concentration that we want to use for this G quarter is 0.5. So I will get this 3.5. I divide it by 0.5. Our desired 0.5. Then when I divide, I get 7 parts. Part of G. Let me say 1 part of G. I'll add 7 parts of water. So that's how we made this bucket of G water.
We have the 4-bucket system. The first bucket we have soapy water. The second one we have clean water for rinsing. Next we have the bucket with jig. Lastly we have water for rinsing. When we're going to clean our instruments, we start by using a brush. After removing from the clean water, we put them into the water that has our disinfectant, which is 0.5% of jig. Then we leave them in there for 10 minutes, not more than 10 to 15 minutes, so that we can prevent rusting of the instruments. This is after 10 minutes. We now come back and we transfer it again to clean water to rinse. After rinsing, we place them down for them to air dry, and then we ensure that we leave our instruments open and spread. So we leave them to air dry. Once they are dry, we proceed to pack in the instruments.
So after washing the equipment on a bucket system, we're supposed to sterilize. I'm going to prepare a sterile pack for wind dressing. Now in our pack we have a jerk. We also have a garlic closer. Also have a garlic closer. And then the guys, put them while they are open. So I'm going to start by bringing this edge here. And then I bring this edge. And then also this edge. Make sure there is space for easily opening it. So the person opening just pulls out this. Then we tie. Then after tying, we label our pack. We also have a drum to sterilize and wash. Here is where the is sterilized from. That's how we check it for them. And then when it is closed, it means there is sterile glaze.
I'm Nurse Rachel. I'm going to perform that testing. This is a training received the in hospital. Frequently done on surfaces, for example, the trolleys, the bed rails, and the size of the screen, as you see. So, to ensure that you're putting on an apron, gloves, boots, and the mask. I'm going to clean the trolley. So you have to begin from the top to bottom. Broom. So this one is used to clean the cobwebs, as I said before. We start from the top to bottom. We clean from the cleanest parts to the dirtiest. Be with soapy water and clean water for rinsing. You apply soap on this. You have to wring it so that it's down. You should not be gripping it. So you clean straight strokes, not in a circular form.